Hello, and welcome to Care Partner Q&A Mondays at the Inspired Memory Care Training, Education, and Resource Center at the 80th Street Residence. Hi, I'm Nettie Harper, and I'm here with
Kelly Gilligan.
And we're coming to you live from the Upper East Side of Manhattan.
We meet here at the 80th Street Residence with our team of professional and family care partners and with the folks who live here for focus groups, pilot testing, and feedback. It's our pleasure to present Care Partner Q&A Mondays as an initiative of the Training, Education, and Resource Center. Please, if you have a topic you're interested in discussing, feel free to type it into the comments section or email us at info@inspiredmemorycare.com. So today's topic of conversation is how important is oral care? Resources and solutions for maintaining a healthy mouth through dementia. And we're here with guest speaker, Dr. Lindzy Goodman of House Call Dentists. Lindzy, welcome. Thank you for joining us today.
Thanks for having me.
We're always happy to have you. So our first question for you is, how can poor oral care affect our health and the health of our elders?
Sure. So we know 50% of adults over 30 and even 70-some% in the elderly population have periodontal disease. And that's the disease of the bone and gums around your teeth. The bacteria around your teeth triggers an inflammatory response and the bone begins to go away. As Shakespeare often describes his characters, his elderly characters, as long in the tooth. And so the relation of oral health and overall health is correlational, as those who take care of their oral health are more likely to take care of their overall health. So Kelly, if you brush your teeth twice a day and floss, you're probably more likely to be someone we see at the gym often. And so we know that's correlational, no doubt. But there has been some research finding causational. Those with periodontal disease are twice as likely to have cardiovascular disease. And studies have shown that the same bacteria found in your gums is also found in your heart. So this bacteria from your mouth gets into your bloodstream, causing a chronic inflammatory process. And the inflammation disrupts our regulatory processes. And this can lead to diseases such as diabetes and cause blockages in the arteries and heart, which can lead to even heart attack and stroke. So yes, oral health does affect our overall health more than we realize, often in a cloaked or even silent way.
Wow.
Thank you for sharing all of that, Lindzy. It's so important. I also have some questions for you. My question is, what are some of the most common conditions you treat in the aging population? And then what preventative measures do you recommend for these conditions, if you can share with our viewers today?
Sure. So just a decade ago, the problems were very different. The most common problem was, Doc, I lost my denture, misplaced it, I need a new denture. We're not seeing that as often anymore, because fortunately, the elderly are keeping their teeth much longer due to more education and also advances within dentistry, such as fluoride in the water. And so people have their teeth longer, and we need to maintain those. Implants are also replacing teeth. So one of the largest issues we're actually seeing in the elderly today is dry mouth. And that's because, it's not because as you get older, your mouth gets drier biologically. That's a common misconception. What happens is, as an elder, you're more likely to be on medications, polypharmacy, multiple medications. And some of these include antihistamines, blood pressure medication, antidepressants, and opiates. These all cause a desert in your mouth. And dry mouth actually causes disastrous progressive decay, similar to what you would see in someone with meth mouth. it's the same type of decay. When you're a kid, you get a lot of decay on the biting surface of your teeth. But when it's dry mouth or meth mouth, the decay happens right around the gum line or on the root surface. And this is what we really see in the elderly population. And it's one of the hardest types of decay to treat as a dentist. It's one of the most challenging procedures we have to do because we have to get under the gum line to treat the decay. So how we can prevent this from occurring in the first place is by, number one, remembering to drink tap water. And tap water is the best because it does have fluoride in it, and drinking it throughout the day. So if you live or care for someone with dementia and they don't do this on their own, it's important to irrigate their mouth throughout the day with water. And you can use a syringe to do that, or just feed them water. So not just meal times. And it shouldn't be juice next to their bed, just plain water. Other products, I have an example here. Biotine, that's really the biggest brand when it comes to dry mouth. Any other products, mouth rinse, sugar-free candies, those type of products are going to stimulate the saliva. And then just to stay away from sugary beverages such as juice and candy and soda. Yes.
Dr. Goodman.
Thank you, Lindzy. And just another reason for us all to drink water, you know, not just the elderly, just all of us drink water. Very helpful for our oral care. Thank you for sharing that.
Yeah, you're welcome.
You actually prompted me with a quick follow-up question, Dr. Goodman, and that, I know a lot of our clients that might be living with cognitive change may not always enjoy drinking water, and I realize juice and sugary beverages may not be a good substitute. Are flavored waters an option? Is that something that might be okay for the teeth?
Yeah, that's a great question. I've heard it a lot. The first recommendation I have is a sugar-free powder that you can put into the water, such as Crystal Light. What's great about that is you get that flavor without the sugar and without the acidity. So I love sparkling water with flavor. However, that has acid, carbolic acid. So the acidity in your mouth goes up or the pH goes down, and that does increase decay. So avoiding bubbly water and using flavor substitutes that are sugar-free is a good option if they're not willing to drink plain water.
Okay, that's great. Thank you for elaborating on that. I know you just changed what I might be drinking in my regular routine, so thank you, Dr. Goodman.
And the trick is to drink, I mean, we're gonna drink soda once in a while and, you know, LaCroix. Drinking it quicker rather than over a long period of time is better for your teeth. So okay. We have to be realistic. We're still gonna have these things from time to time.
Absolutely.
Yes.
All right. So my next question for you is it possible to do a dental visit for a person living with dementia? And what are some of the options when a person's badly in need of treatment, but maybe they're not able to understand the process, or they may not have the ability to sit through a traditional visit?
Sure. So I'm part of House Call Dentists, and after this interview, I'm actually going to Pacifica in the Bay Area to see a patient with Parkinson's, but it has induced dementia. And so this is something I do almost every day with House Call Dentists. And that eliminates the first barrier to care, which is by traveling to their home or facility. We're able to remove that barrier of access to care. So this is often the most comfortable setting for this type of patient and gives us the best chance to get to know them. And so in our first visit, it's diagnostic in nature usually, unless the patient's in pain. And we're really learning about them. We'll determine if treatment can be completed in the home at that time. We do cleanings, fillings, extractions, crowns, almost all dental procedures in the home. And I would say 90% of the dementia patients were able to at least get x-rays using our special methods and tools. But yes, there are some more progressive cases that it's it's too difficult to do in the home. Even if we can get x-rays, we may not be able to do actual dentistry. And in those cases, we do offer other options, including sedation at the hospital or more palliative treatment options rather than restorative. And what's important is that these options are discussed with the patient if they're able to, but also with other decision makers, so their power of attorney, and also their primary care provider, to see what's safe for them and what's rational for them at this stage in their life. One great recent innovation in dentistry, which I love for this type of patient, when it's a more palliative case, it's called silver diamine fluoride, or SDF. And what it does is essentially a liquid I place on an area of decay. So like the root decay we were talking about, which is really hard to treat. So rather than going in, drilling out the decay and doing a filling, SDF just arrests the decay completely. So it stops the progression of the decay, and it's much easier and cost effective to do for this type of patient. The downside is it leaves a black stain, but often that's not a worry at this stage in life. So that has been a great option in recent years.
Wow, that's pretty incredible.
Okay, Dr. Goodman, we know that sometimes a person that is living with dementia may bite down in the later stages during oral care. So are there any tools or techniques that you can recommend to our viewers for safety, especially, if they have a home health aide or a CNA that's helping them, or just a family care partner?
Sure. So I think I've been bitten once, and that was my own fault. If you're prepared, you know how to manage it. I brought this tool over. This is called Open Wide. I wish I had someone I could show it on, but essentially it's a styrofoam block, and you put it between the patient's teeth, right or left side, and it helps them stay open. And it's very soft, so it's not, it's not going to hurt them. And you can order them from specializedcare.com. I can send you links to some of these products after this video if you'd like, Nettie and Kelly.
Actually, Dr. Goodman, actually, Kelly, can you type it into the comment box? Dr. Goodman, can you repeat where people can buy?
Sure, specializedcare.com.
Great.
Perfect. Thank you.
And I don't work for them, but I do use their products a lot.
Thank you, Dr. Goodman.
You're welcome.
And then, Dr. Goodman, so that's a fantastic tool, obviously, because we know that it's challenging to get into people's mouths sometimes to do that deeper cleaning. Are there any other tools or supplies that you would recommend for creating more successful oral care routines?
Sure. One other trick with this too, if you're going to use this, what you were saying is they bite down. And how do you even get them to open in the first place if they're biting down, to get this in between their teeth? One little trick is to take your fingers, use your fingers as a tool, and go to the back corner of their mouth and just stimulate that area. It's not between their teeth. That often gets someone to open. Just going to that back corner between the upper and lower teeth in the way back corner. Other tools, while you're doing that, is this cheek retractor. It's actually used on horses too. And you just go into the cheek. It's very soft, and that it's rounded edges, and retract the cheek. These are called cheek retractors. You can find them on Amazon. Just type in cheek retractors. And this really helps you visualize the oral cavity because all the tissue in the cheek is out of the way. So I really like these. Another important tool, as we talked about, periodontal disease is huge, especially in the elderly population. And it's not easy to get in and, floss traditionally. So one option is a water pick, and that just spritzes water between the teeth. It's better than nothing. It's not as good as traditional flossing, but it is helpful. Some additional aids are these floss picks. This one has a long handle. It's made by Listerine. And then at the end, these heads are replaceable to floss the teeth, and then you don't have to really reach in all the way. You have this tool. If you have this in one hand, propping them open, this in the other, you can go in and floss. That's also not always the easiest. So another option is proxy brushes. And this you can go from the outside, from the cheek side of the tooth, and push in between the teeth where the gum and the two teeth meet. So that's another great tool.
I've actually had a few caregivers, care partners have success using the proxy brushes with people that you wouldn't expect them to work with. So that's great.
Great.
Showing them.
Yeah.
I just want to clarify, Dr. Goodman, for the cheek retractor, would
Yes.
you recommend that a family care partner use that, or would that be something that they might expect to see more from a dental professional? What are your thoughts surrounding that?
If a care professional were to use this, they're going above and beyond.
Okay.
So, you can only use this for one patient. You don't want to mix these up between patients. Otherwise, you would need a sterilizer, which you're not going to have access to necessarily. So, if the families or the homes are willing to invest in these to keep them where you keep their toothbrushes, that'd be the dream. Is it realistic? Again, I'd be super impressed if I saw a caregiver using these. So, and when we do house calls, I usually leave one behind for them and teach them how to use it. I think it's just going and ordering them first.
Yeah, I think that's a wonderful
how to use it.
I think that's a wonderful piece of what you're offering, though. I think some people may look at that, and like, I know if I saw that, I'd be intimidated trying to figure out how to use it correctly and introduce it to a client. But I think having guidance from a dentist that's a really valuable resource that you're providing to care partners. So thank you for that.
Yeah, and just to comment off that, Dr. Goodman, that's one of the things that we've always been impressed by you is that when you go in and you work with a patient, you involve the care partners, whether it's family care partners or the professional care partners, that you involve them and you educate them on how to follow through. So that way, when you come back, there's also improvement with the mouth and the oral care. So it's not that you're just coming in and you're doing the cleaning, but you're also educating them on how to do it on a daily basis. And I think that's so important because some people, they're trying so hard, but they don't know these techniques and they don't have these supplies. So I really appreciate that you take the time to educate as well.
Thanks. And yeah, what I've heard from caregivers is that they don't have much training for oral health in their programs, which is unfortunate. So I'm happy to teach, and there's no guilt or anything associated if they're learning. I love teaching. So that is part of it when we go do these house calls.
Absolutely. So we have to talk about it. It's happening all around the world.
Sure.
Dr. Goodman, during the pandemic, would you recommend continuing with routine oral care? It is a burning question. As we know, many people are skipping their regular routine medical appointments and certainly their oral care. So what is your opinion? Can you share it with our viewers?
Yes, this is a very hot topic in the news. We've seen it, and every time the CDC doesn't, recommend going, everyone in our office freaks out because it's like, oh, another shutdown. And I'm biased, I'll admit that, because I am a dentist, and I think it's important to continue your oral health care. What's most important during this time is focus on your home care routine. Because we want to prevent these unnecessary dental visits. So the first step is doing your part in the home. Because maybe 90% of dental visits are preventable. So that being said, because of COVID, there are so many people under stress, and we have never seen so many fractured teeth because of grinding and clenching. And that was actually in the New York Times. So we're continuing to see dental emergencies out of stress more than anything during this time. We cannot just close our doors to patients, and we must take extra steps to stay safe. So I ask the audience to ask your dentist before going in what steps they're taking. It's important that you feel comfortable and safe. So there's a risk benefit of everything we do outside the house right now. And we really don't know how long this is going to go on. Because as discussed earlier, oral health is connected to your overall health, and we cannot neglect it. Some steps house call dentists and our office has taken to keep our patients and employees safe include implementing a teledentistry platform. A lot of physicians have done this, and we haven't seen it quite as much with dentistry. We tend to lag behind medicine a little, but what we do is we triage our patients on a video chat like we're doing right now before they even step into the office. So if it's something we can treat with antibiotics, then we just save them a visit. Or we can save chairside time by knowing exactly what procedure we're going to be set up and ready to go do when they walk in. We also do questionnaires for every patient if they've been around with anyone who's had COVID, the typical question. And then everyone gets their temperature checked before they step in the door. They're wearing a mask. They've been hand sanitized. We also offer rapid antibody test as an option. And if you came into our office, you would see that everyone looks like an astronaut that works here. We're just covered from head to toe in gear. And it's warm, but it's necessary right now. And then we also spread out our patients. So you won't see a waiting room that's full or magazines laying out for people to touch. You'll see air purifiers throughout the dental practice. So, you know, offices have invested a lot of time and money into keeping their patients safe and their employees. And we haven't heard of a breakout stemming from a dental office yet. And I really hope that continues to be the case. So number one, continue your home routine and be really on top of it so you can prevent an unnecessary dental visit in the first place. I would say if you're very medically compromised or at risk, defer treatment unless it is an emergency. Just defer treatment for now and focus on your home care. But if you're healthy and you go to a practice taking adequate precautions, I don't recommend delaying your routine care, including your cleanings. And one thing we've seen because of the pandemic is a huge increase in house calls. So if you are worried and it's going to cause you more stress thinking about going to the dentist, consider a house call where we come to you.
Dr. Goodman, I think that's really, really solid advice and realistic and practical. So thank you for offering that to our viewers. We know that you work for House Call Dentists, and we just wanted to ask, would you mind sharing with viewers how they might be able to reach your organization if they did want to set up an appointment and kind of the locations and catchment areas that you serve?
So we have locations in San Francisco Bay Area, as well as New York City. Right now, I'm primarily in our San Francisco office because travel is limited. Dr. Marciel is our New York dentist. She's amazing. She is really good at treatment in the home, which is the hardest dentistry to do. And so if you are interested in learning more or would like to book an appointment, you can go to housecalldentists.com. And it has all our information listed there. Or our phone number is 646-461-1295.
Okay, and I'm going to type that in the chat box right now for our viewers.
Sure.
Dr. Goodman, thank you so much for the service that you're providing, and also just for the teaching that you do. I think, you know, for the general public or viewers that might not be in your catchment area or have access to your service, your knowledge is really valuable, and we really appreciate your time and your sharing with us. So thank you.
Thank you for having me and putting this all out there.
Absolutely. All right. Well, so we want to conclude the interview and wish you well, and hopefully we'll be in touch soon. And stay safe in San Francisco.
Again, Kelly and I would like to thank you for joining us for another Care Partner Q&A Monday episode. And to learn more about the 80th Street Residents, please visit their website at 80thstreetresidents.com. And also, please feel free to take one of their virtual visits. And if you'd like to learn more about Inspired Memory Care, or feel free to ask us a question about something you heard about on the episode today, please feel free to join us on our website at inspiredmemorycare.com. You can also learn more about our on-demand webinars, a subscription activity program, and our certification program, which we will be offering again in January. Again, we'd like to thank Dr. Lindzy Goodman from House Call Dentists for being our guest speaker today. Thank you so much. And as for next week, we will be taking the week off for the holidays. We wish everyone a happy holiday. We will be back for Care Partner Q&A Mondays at 3 p.m. on Facebook Live on November 30th. And we will be having some special furry guests, so you won't want to miss this episode. Our episode will be entitled Animal Assisted Interactions and Dementia, How a Four-Footed Friend Can Help. Again, guest speakers from New York Therapy Animals, and they will be bringing some furry surprises. So this is an episode you won't want to miss. Take care and happy holidays. Stay inspired.